Welcome back, guys. Now in this video, let's discuss about inflammatory mediators. Already we have discussed about the acute inflammation. See that inflammation need to be facilitated. Okay, someone have to do the vasoconstriction, vasodilation, someone have to do the increased vascular permeability, and there should be chemotaxis. For that you need the chemotactic agents, and there is phagocytosis, opsonization. See, there are different chemicals or the inflammatory mediators, I should say, they are all involved. These inflammatory mediators that I am going to discuss right now, they will facilitate the process of inflammation. They will, because of this inflammatory mediators, the inflammation is happening. They mediate the inflammation. So that's why these chemicals are called as inflammatory mediators. Okay. So now let's begin our topic, inflammatory mediators. Okay, inflammatory mediators. See, these inflammatory mediators are of how many types? Mainly the inflammatory mediators are classified into, okay, they are classified into two types, cell derived, okay, and plasma derived. Okay, cell derived and plasma derived. So you know the difference here itself. So the chemicals which are released by the cells, the inflammatory mediators which are released by the cells, they are cell derived, and the chemical mediators which are released from the plasma, which are synthesizing from the plasma. Okay, like from the plasma, like complements. Okay, complement activation, complement proteins are there, they will be activated, and clotting cascade. Clotting cascade. Okay, they are plasma derived. Then what are cell derived? So if you ask me what are cell derived, okay, see, cell derived are again of two types. What are they? They are preformed and newly synthesized. Okay, newly synthesized. What does I mean by preformed? See, preformed things are not getting newly synthesized, they are there from long time. Okay, they are always there. Not only at the time of inflammation, they are already there. Okay, for example, if you go to certain restaurants or if you go to KFC, the things are already prepared. They are not specially prepared for you. Okay, they are already there. They will just make it warm up and they will give you. Okay, right? So these are also preformed, which means they are always there. They are contained inside the vesicles. Whenever there is inflammation, they are released. And what are newly formed? Newly synthesized are those inflammatory mediators which are produced only during the time of inflammation. They are newly synthesized and released. Okay, like a good restaurant which will make food when you only order it. They do not have any pre-prepared things. Okay, something like that. So what are the examples of preformed inflammatory mediators? Preformed inflammatory mediators examples are histamine and serotonin. Okay, so histamine and serotonin, these are preformed. Then what are newly synthesized inflammatory mediators? Newly synthesized include nitric oxide, okay, nitric oxide, arachidonic acid metabolites, okay, arachidonic acid metabolites, chemokines, cytokines, reactive oxygen species. So all these are examples of inflammatory mediators which are newly synthesized. Okay, nitric oxide, arachidonic acid metabolites, cytokines, chemokines, reactive oxygen species. One thing which I forgot is the platelet activating factor. Okay, PAF, platelet activating factor. See, all these are examples of newly synthesized mediators. After this, let's begin our topic with cell derived inflammatory mediators, that is preformed. Okay, let's begin our topic, cell derived. Now in cell derived, we are starting with the preformed. So what is the most important? First thing is histamine. So histamine, what is the major source of histamine in the body? See, the major source of histamine in the body is mast cells. From where this histamine is coming? It's coming from mast cells. Okay, mast cells release histamine. And this histamine, it is derived from which amino acid? Biochemistry, it is derived from histidine. Okay, it is derived from amino acid, that is histidine. Okay, sir. Now, what are the functions? Before going to the functions, I want you to know not only the mast cells are the major source. Okay, mast cells are the major source. Apart from the mast cells, there are even other cells like platelets, basophils. Okay, platelets, basophils. These are also the cells which can release the histamine. What are the functions of the histamine, sir? What it will do, how it is going to help in the process of inflammation, how it is going to mediate the inflammation is, see, this histamine is a vasodilator. Okay, functions. It's a vasodilation. Apart from vasodilation, it also causes increase vascular permeability. Okay, it increases the vascular permeability and bronchoconstriction. So, what I want you to know is, see, the increase in the vascular permeability, increase vasodilation, all these are the vascular events in the inflammation. These are the vascular events in the inflammation, right? So, the histamine during inflammation is going to be released by the mast cells, which aids in inflammation, which helps in promoting the inflammation. That's why it's inflammatory mediator. Okay. So, what are the three functions of the histamine? Vasodilation, increased vascular permeability, and bronchoconstriction. Okay. After this, let's discuss about serotonin. Okay. Serotonin, say, which is also called as 5-hydroxytryptamine, serotonin. This serotonin is also newly synthesized, not newly synthesized, it is also preformed. It is derived from which amino acid? It is derived from tryptophan. Again, biochemistry, histamine is derived from histidine, serotonin is derived from tryptophan. Who produces this serotonin in the body? The two major sources, first major source of histamine, serotonin is enterochromaffin cells. Okay, enterochromaffin cells. This is a major source of serotonin in the body, and platelets. Okay, platelets also produces serotonin. See, serotonin have lots of functions in the inflammation. See, they helps in it acts as a chemoattractant. It helps in phagocytosis. It helps in release of the pro-inflammatory cytokines like interleukin 1 and interleukin 6. Okay, it's having lots of roles. Okay, so it is also an inflammatory mediator. It helps in phagocytosis too. It helps as a chemoattractant. It helps in the release of the pro-inflammatory cytokines. Okay, from different cells. So the two important preformed inflammatory mediators are completed. What are they? Histamine and serotonin. Done. Now after this, let's start with the cell derived newly synthesized. Okay, now I am starting with again cell derived, but they are newly synthesized. Okay, now they are coming newly. So what is the first one? Nitric oxide. Okay, just as a recap, I am telling you nitric oxide is there. Arachidonic acid metabolites. Arachidonic acid metabolites. Third one is cytokines, chemokines. Okay, fifth one reactive oxygen species and platelet activating factor. These are the things which we have to discuss right now. Now let's begin with the nitric oxide. First one, nitric oxide, this fellow. Okay, so let's take the heading here, nitric oxide. So this nitric oxide, it is derived from which amino acid? Biochemistry, it is derived from L-arginine. Okay, it's derived from the L-arginine. See, this L-arginine is going to be converted into nitric oxide along with L-citrulline. It's a pure biochemistry with the help of an enzyme. Okay, with the help of an enzyme called as nitric oxide synthase. How many types of nitric oxide synthase are there? This is very important. There are 3 types of nitric oxide synthase, that is enos. Okay, endothelial cells produce the nitric oxide synthase. Endothelial have this nitric oxide synthase, which will convert the arginine into nitric oxide. Okay, nitric oxide. Next, enos, nnos, neuronal nitric oxide synthase. Even nervous system produces the nitric oxide. And inos. Okay, inducible nitric oxide synthase. So there are 3 types of nitric oxide synthase. Done. Okay, it's of 3 types. Now, once okay sir, nitric oxide is there. So what this nitric oxide is going to do? What it is going to do? Nitric oxide, it's going to cause vasodilation. Okay, it helps in inflammation, right? So vasodilation. Apart from this, nitric oxide also having anti-aggregant property, means anti-platelet. It inhibits the platelet aggregation. So it is anti-aggregant. Okay, it's an anti-aggregant, sir. Anti-aggregant means inhibits platelet aggregation. Okay, inhibits the platelet aggregation, sir. Completed. Now, after this, let's discuss about the other newly synthesized mediator, that is platelet activating factor. Let's begin with the PAF. Platelet activating factor. Who produces this platelet activating factor? Many cells, like endothelial cells produce the platelet activating factor. Okay, endothelial cells and neutrophils, macrophages, okay, monocytes, they all produce the platelet activating factor. What it will do during inflammation, this platelet activating factor, it can do both the things. It can do 2 things: vasoconstriction as well as vasodilation. Okay, vasoconstriction as well as vasodilation. In high quantities it can do vasoconstriction, in low quantities it can do vasodilation. That's the important point which I want you to know. Platelet activating, the name itself is platelet activating. What platelets will do? Once the platelets are activated, they will be aggregating. So it helps in platelet aggregation. Okay, platelet aggregation. So it depends on the quantity. It can do both vasoconstriction as well as vasodilation, and it can cause platelet aggregation. And the 4th thing is bronchoconstriction. Okay, it can cause bronchoconstriction. See, bronchoconstriction is mediated by platelet activating factor, true. Histamine also causes bronchoconstriction. But who is the most potent bronchoconstrictor? What do you think? What do you think is the most potent bronchoconstrictor? See, the most potent bronchoconstrictor is not the histamine, is not the platelet activating factor, it is leukotrienes. Okay, leukotrienes. We will discuss about these leukotrienes, especially leukotriene E4, okay, leukotriene B4. They are the most potent bronchoconstrictors. Leukotrienes are the most potent bronchoconstrictors, not the histamine or not the platelet activating factor. Okay, having said that, now let's discuss about the chemokines. Chemokines are nothing but, like in the name itself, it's there. Chemo means chemicals, kines helping in the movement of its cells, like the leukocytes and neutrophils especially. So now let's begin with chemokines. Chemokines. So based on the structure, chemokines are divided into many types. Okay, first of all, chemokines are nothing but the chemoattractants. Chemoattractants means they attract these are the chemicals which will attract the different types of WBCs, chemoattractants. So how many types of chemokines are there? First, C type of chemokine. C type of chemokine. CK means chemokine. C type of chemokine. Okay. So what is the example of C type of chemokine, sir? The first example of C type of chemokine is lymphotactin. Lymphotactin. So in the name itself is there, lymphotaxis. Okay, it's going to attract lymphocytes. Next, CC chemokines. What are the examples of CC chemokines, sir? Eotaxin, Rantis. See, Rantis is a type of chemokine, okay, and MCP. Eotaxin, Rantis and MCP, they are all examples of CC type of chemokines, okay, based on the structure. Eotaxin, the name itself, it's there is nothing like, a new eotaxin, eosinophils, simple. Okay, Rantis for T cells, and MCP, you can easily understand, like, find it out, MCP, macrophages, okay, attracts macrophages. So, during inflammation, all this type of chemokines are going to be released, okay, in the inflammatory area. So, they will attract different types of WBCs. Next type of chemokines are CXC type of chemokines. CXC chemokines, example is interleukin 8. So, this interleukin 8, already we have discussed in the topic of acute inflammation. Interleukin 8 is going to be a chemoattractant. It attracts neutrophils, MCQ. Neutrophils. Okay, it is going to be called the neutrophils, interleukin 8. And the last type is CX3C type of chemokines. Example is fractalkane. Okay, so fractalkane. Just wait. Okay, fractalkane. So, it is going to call T cells and macrophages. So, chemoattractants also completed. So, how many types in total in general there are? How many types of chemokines? C type of chemokines, CC type of chemokines, CXC and CX3C type of chemokines. For example, in your exam, question can be something like eotaxin CC, Rantis CC, fractalkane CX3C, okay, interleukin 8 CXC, okay, something like that. So, chemokines are also completed. After chemokines, now let us discuss about different type of cytokines. Okay, one more type of cytokines which are called as the interleukins. Okay, interleukins. They are nothing but cytokines. Okay, interleukins. So, what are the different types of interleukins that you should know for your exam? Are first, let us begin with the one, interleukin 1. Interleukin 1. See this interleukin 1. What is it going to cause? How it is going to help in inflammation? Interleukin 1 is going to cause fever. Okay, it's a one responsible for the fever. So, it's a pyrogen, interleukin 1. Next, interleukin 5. Interleukin 5. Okay, interleukin 5. Just continue. Interleukin 5 is going to cause eosinophil activation. Eosinophil activation. Interleukin 6. We have already discussed, I think, interleukin 6. Interleukin 6 causes fever. Okay, so fever is caused by interleukin 1 and interleukin 6. 1 and 6. See, interleukin 6 is very, very important. It regulates the levels of acute phase reactants. Okay, it's regulation of acute phase reactants. Okay, 1 completed, 5 completed, 6 completed. Interleukin 7. Interleukin 7 is going to cause T cell maturation. Okay, T cell maturation. Next, 7 also completed. Interleukin 8. Okay, interleukin 8. See, already we have discussed about the interleukin 8. Where we have discussed interleukin 8, it's going to recruit the neutrophils. It recruits the neutrophils. Just now we have discussed. See, interleukin 8, it's a chemokine. Yes, what it will do? Recruits neutrophils. After 8, interleukin 10. Okay, interleukin 10. The very important point about the interleukin 10 is, see, interleukin 10 is not pro-inflammatory, rather it is anti-inflammatory. It's against the inflammation, it stops the inflammation. After some time we need to stop the inflammation. We cannot simply continue the inflammation throughout throughout the life. At certain stage we have to stop the inflammation. Okay, inflammation completed, now we have to go for the repair. So this interleukin 10 is anti-inflammatory. Anti-inflammatory. And interleukin 4 and 6. Now why I am discussing 4 and 6 again here is, see, they are both pro and anti-inflammatory. Okay, so what is only anti-inflammatory, which is absolutely anti-inflammatory, is interleukin 10. But interleukin 4 and 6, they can act pro-inflammatory as well as anti-inflammatory also. Okay, both pro plus anti-inflammatory. Okay, so 4 and 6 are also completed. Now after this interleukins, let me discuss about tumor necrosis factor, TNF, tumor necrosis factor alpha, which is something similar, TGF. Again, herein it is G, TGF alpha and TGF beta. See, what are these things and what's their role? What's their role in inflammation? See, TNF alpha is responsible for fever, inflammation. Okay, it's responsible for fever and responsible for the symptoms of cachexia. Okay, so fever and cachexia are mediated by TNF alpha. TGF alpha, here it's not, I'm not talking about the inflammation. This TGF alpha levels are elevated in one condition. There is a disease called as Meniere's disease. Meniere's disease. Sir, in this Meniere's disease, okay, see, Meniere's disease means there is a hyperplasia of the foveolar cells in the gastric gland, or in the gastric mucosa. Okay, in the gastric mucosa, who is the one producing the mucus? It's the foveolar cells. If the foveolar cells are undergoing hyperplasia, why they are undergoing hyperplasia? Because of elevated levels of TGF alpha. This TGF alpha levels are elevated, so the foveolar cells are undergoing hyperplasia. So the gastric rugae are going to look like now gyri and sulci of the brain. Now it's going to look like the gyri and sulci of the brain. So this disease is called as the Meniere's disease. Yes, we have discussed this in the gastrointestinal pathology also. But simply one point which I want you to know is this TGF alpha levels are elevated in which gastric pathology? Meniere's disease. Done. And TGF beta. TGF beta helps in fibrosis. Okay, it's going to cause the fibrosis. Next, after this, let's discuss about interferons. These are all cytokines. Okay, interleukins, TGF alpha, TGF beta, TNF, all these are the cytokines. Okay. Now, interferons. How many types of interferons are there? There are 3 types of interferons which I want you to know for your exam. Interferon alpha, interferon beta, interferon gamma. Alpha, beta and gamma. Interferon alpha is produced by macrophages. Interferon beta is produced by fibroblast. And interferon gamma is produced by the T helper 1 cells. Okay, T helper 1 cells. Interferon alpha. What is the function of this interferon alpha, which is coming from the macrophages? Interferon alpha is antiviral. Interferon beta, which is coming from the fibroblast, you know it. Okay, interferon beta, it helps in fibrosis, but not only that, this interferon beta is used in the treatment of certain diseases, especially multiple sclerosis. It's used in the treatment of multiple sclerosis. Okay, and interferon gamma, which is coming from the T helper 1 cells, it helps in granuloma formation. Okay, granuloma formation. So with this, interferons are also completed. Now in the next video, okay, we'll discuss about arachidonic acid metabolites. Okay, that's the COX pathway, cyclooxygenase pathway and lipooxygenase pathway will be discussed in the next video. In this video, we have discussed the basics about the inflammatory mediators, different types of inflammatory mediators. Okay, that's a preformed, newly synthesized, how they are going to help you in the process of like inflammation, how they mediate the inflammation. important points discussed. We'll see in the next video with the arachidonic acid metabolites. Hope the video is helpful. Thank you.